Today I'm going to show you how to take your own blood pressure with an Aneroid blood pressure monitor. The equipment we are going to need is a stethoscope for listening to the arterial sounds and a blood pressure cuff. This consists of a cuff with an inflatable bladder, a pump with a valve and a pressure gauge where you will read your systolic and diastolic blood pressure. We are going to take blood pressure while seated. Sit comfortably in a chair and wait a few minutes to allow yourself to be in a calm state. Flex your arm so that your elbow is at the level of your heart. You can support your arm with a pillow if it makes it easier for you. Now we are going to position the cuff. It is important to choose a cuff that is a suitable size for your arm. If necessary, measure the circumference of your arm beforehand and select an appropriate cuff size. As a general rule, the bladder of the cuff should be 80% of the circumference of your arm. Now wrap the cuff around your bare upper arm so that it sits a couple of centimeters above your elbow crease. The tube should be facing down away from you. Some models will have an arrow indicating the position where your artery should be. The cuff should be comfortable and not too tight. You should be able to fit 2 fingers underneath. Now place the bell of the stethoscope just under the cuff face down. Next, place the stethoscope in your ears with the earpieces facing forward. Take the pressure gauge and place it in the palm of the hand that has the cuff on it. Hold it gently without squeezing and make sure you can easily read the values on it. Now take the pump and squeeze it rapidly until the dial reaches 180. Then gently release the valve with your thumb and forefinger by turning it towards you. Release it at a rate of about 3 mm per second. Keep watching the gauge and listening for the sounds of your heart. When you first hear a heartbeat, note the reading. This is your systolic pressure. When you no longer hear any sounds, that is your diastolic pressure. Once you no longer hear any sounds, you can release the valve completely and remove the cuff. Note down your systolic and diastolic pressure, as well as which arm you measured and the position you were in this case, sitting. You can repeat the process for your other arm, making sure to record the result and note any differences. If your blood pressure is high, wait a few minutes and measure it again twice. Now you know how to take your own blood pressure with an Aneroid blood pressure monitor.